Right.
Sounds good to me.
Yes. Let me wait. I need to get the link. All right. Should I hit go live right now, and then we can? All right, and
It's
we're
up to
live.
you, folks. I'm fine either way.
Do we want to wait, or do we want to start? Because we can start whenever. All right. One second. I'm gonna update one thing.
Okay, so welcome to No Brain, No Gain. This is pretty much just a podcast that aims to empower the youth audience through one-on-one discussion with speakers at various points in their neuroscientific, psychological, and medical careers.
All right, Yasmin. Whenever you're ready.
To ourselves as your hosts for today, we'd like to acknowledge that this podcast is recorded on the traditional ancestral territories of many Indigenous nations across Canada.
This podcast is an initiative by the Shine Project, a youth-led organization that empowers youth to pursue and engage in scientific careers.
Yeah, and I'm Yasmin. My pronouns are she, and I'm a student living in Canada. And I'm super interested in mental health and just the proper literacy.
So hi everyone, welcome to our first episode of No Brain, No Gain. My name is Aditya, my pronouns are he, him, and I'm a student living in the United States. I'm also very passionate about neuroscience. Alright, our speaker for today recently graduated from the University of Guelph with a Master's of Public Health and plans to start her Ph.D. studying mental health promotion in the fall. She's volunteered in the
Yeah,
youth
so
mental
please
health
join us
space
in
in her
welcoming our
local
first
and
speaker for the
university
No Brain, No
communities.
Gain podcast, Jill
With Mental
Stringer.
Health International, Jack.org,
Hi,
Frayme, and the Mood
everybody.
Disorder Society of Canada as a
Thanks for
co-chair.
having me. For the audio
She's
recording, that will be
passionate about the
obvious.
mobilization of knowledge to promote health at the intersection
I'm
of
happy to
physical,
be
social, and
here.
psychological health, particularly for young folks.
Yeah, and it's been inspiring to see your work with the Mood Disorder Society of Canada and how you've put so much
Yeah, we're
effort
really
to further
excited to have you
create
as a
this
speaker
space
today.
for conversations
And
that
I
we
know
wouldn't usually
I
have in
speak
our
for the
school
entire
communities.
podcast team expressing our appreciation that you're willing to have these kinds of conversations with
Thank
us
you both.
and to inspire youth
It's
across
an
the
honor to
globe
be here, and I'm
for
so
taking
glad to
initiative
connect
in mental health.
with folks like yourselves. And I was certainly not doing what you are when I was your age, so it's incredibly impressive and really encouraging. This is an awesome question, and truthfully, youth engagement in all subjects are important. Anywhere that impacts a youth, you should be involved.
So,
But I think I
our
kind
first
of
question,
boiled this
how
one
do you
down to
think youth engagement in
three
mental
big
health is
reasons
important?
that engagement in mental health is important in particular, and is that youth are like these years are our formative years, and so we're not only setting the groundwork and a solid foundation for our future and our health in the future, but we're also at the or the majority of mental health challenges onset. So this means things like early identification and intervention are super crucial. I'm really passionate about is health promotion and prevention of illness and ill health, and these are super effective. And in order for them to really be truly effective, the interventions would have to be adopted in a way poignant to the youth who they're targeting. So youth have to be involved in that respect as well. A saying that I heard often and that I really like is nothing about us without us. And so I think that kind of highlights how youth need to be involved. Second point is that young people are kind of the next generation. And so, like, the future doctors, the future teachers, the future artists, and you folks, and I guess myself as well, do have the capacity to change the discourse and like the perspectives around mental health and mental illness and neuroscience and psychology. And so this kind of also has like twofold benefits. So, you know, we can bring creative ideas to the table, and we can also learn from others who are at that table and build skills for our futures in doing so. And ultimately, the third reason is just that youth engagement, it leads to better outcomes. You know, it fosters a sense of ownership, empowerment, and like it builds community and it builds capacity. And through this kind of like engagement, we'll have better health outcomes, we'll have better economic outcomes, and it'll just be positive mental health as the goal, with youth being involved from the ground up. I think that's all I had. I know I kind of rambled a little bit. Sorry.
All right. Yeah, I don't think that's a problem.
Yeah,
But yeah, I
and
think I do
I've
see like
seen the
early
sorry.
onset of like some
I
conditions
agree
affecting
with
high
you. I've seen
schoolers
the
and
college
college
or the
students.
high school to college, high
So
school
I
to university
believe
transition
that I also
a
go
lot,
that
being a place that's kind
being
of
engaged
a big
early
significant stress for
is,
most folks
of
because
course,
they're in
a
a new
better option.
environment, they're in a new city often, they're not with their family, their friends, and so that is a lot too. Like helping you through these transition stages is really important, and the best people who know what youth are experiencing are youth themselves. So if we really want to facilitate these transitions in a healthful way, youth have to be involved there.
Yeah.
And we also had another question. We are just going to ask, like, what do you think is the true value of lived experiences? And do you have any tips for people with lived experiences that are looking for ways
Yeah.
to change their communities and the world?
I think this goes back to the quote I already said about the nothing about us without us. So while youth should be involved in making decisions, folks with lived experience should be involved in designing services and systems that effectively meet the needs of those who are supposed to be receiving them. And so truly integrating and actually listening to the views of the community, in particular those with lived experience, helps us avoid what in public health we call paternalistic approaches, where a decision is made on behalf of someone else with thinking that it's in their best interest without necessarily involving them in that process to the fullest extent possible. And so truly valuing lived experience in this sense helps ensure that like folks have individual autonomy and that our services are also more appropriate, effective, and efficient, I think.
Mm-hmm. Yeah, I think that's honestly such a great tip because I see in even in my own school community how people aren't reaching out to the student body, that it's so relevant that you need to reach out to them to get appropriate resources for them. So I think that's such a great point that you made.
In terms of, sorry, I was going to say answer the second part of the question. I just wanted to leave room for discussion. Ask. Okay, in terms of advice for folks who
So
want
into
to
like,
use their lived
oh,
experience
go
to
on, go
make
on.
change, I think um, a phrase that I like to acknowledge is the lived expertise, I guess. So kind of framing
You can go ahead.
experience as expertise
Yeah.
is an important reminder for I think any use their own lived expertise that your experience is valuable and truly is a form of expertise, and knowledge from lived experience shouldn't be considered any less than or secondary to anybody else's. So, folks, you do have a lot to bring to the table, and I think remembering that is important. The second thing I would say is, in particular for young advocates, there's a lot to be said for like reflecting on where you are personally in your mental health journey or your lived experience journey, and kind of asking yourself like what your goals are and what you're and not comfortable disclosing, and then kind of taking that a step further and thinking about how you can advocate or you can use your lived experience and that is safe and that your knowledge is respected, is actually valued. So, watching out for those red flags and ensuring that your interactions are healthy and safe for both you and those you're advocating with or for. So there definitely is some nuance to it, and I recognize also that for reasons of safety or opportunity or personal preference even may not use their lived experience in the same way as you do, or they may not choose to advocate outwardly or vocally about their experience, and that's totally valid as well. Because not everyone's experience is the same, and the way their recovery is not the same, and the way they choose to use their experience is also unique. So I think that's also important because it's something that's easy for me to miss because I do a lot of this stuff with you folks. Yeah, I thought that was also worth mentioning.
Mm-hmm.
Um, so this is a hard question because part of the reason I love South is
All
because
right.
it
So
is
about
so broad in
what you
scope,
do,
and I
what do you
am interested
love
in a
the
lot of
most
different
about what you
things.
study, and
Public
about the work
health,
that you do outside of your
from a
studies?
definition, kind of refers to promoting health of communities. So by like preventing disease or prolonging life, and kind of doing so collaboratively, both public and private, with groups of people and with individuals. So it's really, really broad. Um, I started my undergrad in the sciences, actually doing molecular biology of all things, and I grew an interest in psychology along the way, with my own lived experience and witnessing that of my peers and my friends and family. And then I ended up thinking maybe I wanted to pursue social work or pharmacy or counseling. But ultimately, what I kind of discovered to learn about was the impact of all these different social, environmental, and individual factors and how they impact someone's well-being or groups of people's well-being. And so I really love that both my academic experience and my work and my volunteering experience have exposed me to so many different perspectives and ideas. And although I've generally kind of approached it from an angle of psychological health and mental health, I've met so many passionate people like yourselves who have different perspectives that they bring to the table, and I just really love taking it all in, and I love knowing things. So like the more I connect with different groups through volunteering and through work, the more I recognize how interconnected all of it is, and like how our systems and our situations interact in complex ways to determine our health. And that to me is what's really interesting, because there's so many for intervention and so many ways that we can improve and do so collaboratively. And so, like, sharing our knowledge, mobilizing our knowledge, and giving folks the power to improve our community well-being is what's really exciting for me. So I guess that was a really long-winded answer, but I love the diversity of public health and the folks that I meet along the way.
So as someone who hopes to enter the health field, I'm glad to see that you like to analyze the different perspectives that everyone gives and then improve on that as to like
I would like to
having
think, oh,
diversity in thought.
I don't have
So
sort of
do you
any
think
tangible
that
ways to measure that yet,
like
but it is
being able to
something that
see
I
the
kind of
diversity
make a
in
point
thought
of
like
myself
has
to
advanced
always
your
keep in mind,
studies or
because I'm a
experiences
naturally
in
like
public health?
inquisitive person and I want to know things and I want to sort of use my brain to think of things in different ways, and like that complex problem solving and sort of collaborative approaches to me is what's, to a certain extent, I feel like it kind of comes naturally. It's where I tend towards myself. But I also recognize that lots of other folks are
Yeah.
similar to you. You mentioned you want to be in the medical field eventually, and I've connected with so many youth like yourself who
Hmm.
are passionate and are really dedicated to keeping open perspectives and incorporating like diverse opinions and voices in their practice and amplifying those voices. And I believe overall that that will make a difference in the future of our healthcare, and it's really
Hmm.
inspiring to see young folks like yourself who are so open and eager to learn and compassionate and empathetic, as the future of these medical professionals.
Yeah, so just another question. Like, what are the biggest things you've
Hmm.
learned by volunteering
And
for
just to
mental
add
health, and
on,
has
like
it
you said
helped you
before,
in
is you are
any
an
other
inquisitive
areas as
person. But
well?
yeah, like that is a pretty important trait to have when you're going into the public sciences, right? Like asking the
Um,
questions first.
Many of the things like we're chatting about today, I credit to volunteering for mental health, connecting with folks like yourselves, and I may not have learned as soon or the same way without my volunteer experience. So it is something I'm really, really grateful for, and I recognize I'm very privileged to have had. Like the value of lived experience and the importance of integrating these diverse perspectives, like we were just talking about, and how, we've connected with so many different organizations and individuals and groups, and how that collaborative approach to problem solving and conflict is kind of a necessity when we're talking about topics like this. And it is like really a constant learning experience. And I know that sounds kind of lame to say, but I think that's why I like it so much. And of course, it's helped me outside, develop my professional network of peers, develop my communication skills and my leadership skills, and personally be less afraid to use my voice in meaningful ways. I think one thing I'm still learning, and of course I think I will still be learning ongoingly, is that is to appreciate what I bring to the table and to appreciate what others, and then recognize where others are still excluded from these discussions. And so I want to kind of continue learning how I can make these spaces better for those who come after me or those who weren't as privileged as me and had the experiences that I have had. So even expanding my allyship in that sense, is something I'm really thankful for, and I hope to continue. And I think is something that will be important for me to bring outside of wherever I'm volunteering, just into my life in general.
Mhm. Yeah, and I know you said that you had the privilege to kind of involve yourself in mental health opportunities, but I know that a lot of youth watching obviously don't know where to start. They want to jump head first and they can't find these opportunities because they can be hard to locate. So, I mean, what was your first step to joining these mental health organizations?
I did kind of a community search, like a Google search type thing, to find out what was out there. Um, Fortunately, at my university, they had kind of like a volunteer job board and listings of community organizations that you could get involved with. And so I kind of read through mission statements and tried to identify one that resonated with me. Um, and kind of by a gut feeling, I kind of gravitated towards the mental health, the psychology, the community kind of. And so that first sort of just doing a scan of, what's out there and then reflecting on what your goals are and what was probably how I would recommend going about it. And now there's so many virtual opportunities as well. It never hurts to go and connect with, the Shine Project accounts and see who else is connected with them and kind of dip your feet in the water that way, just get exposed to what's out there.
Yeah, I think that's honestly such a great kind of thing that you added to look at those like community search boards, because you never know when there's going to be a small opportunity to just kind of start your involvement with mental health. So yeah, thank you so much.
Yeah, and don't be afraid to reach out to those community organizations or those individuals. Like, even if you're not sure what the volunteering would be about, or you're not sure what you're interested in, you can always learn more from them, and they're really happy to share their experience with you. And if you help out, they're happy to have you on board. So I definitely say don't hesitate to work in that respect as well.
Mm-hmm. Yeah. Well, I mean, that's all the questions that we had prepared for you today, Jill. So I just want to thank you. I know that I personally retained so many great tips and advice that I will be using in like the rest of my high school years and further.
Thanks, Yasmin. I'm at risk of like spouting so many cliches. I will say that I truly do think no actions are too small, and I'm sure you folks have been virtual learning for a better part of 2 years as well as I have. And so it feels like now more than ever, it's so easy to become siloed in our own spaces and kind of lose touch with what else is going on. But I really am reminded, when we come together like this in volunteer collaborations or projects, the DTI, this is like, it's really inspiring and energizing. And this is when I see all the creativity and the innovation that comes from our passion. And so I'm reminded kind of that the power we have as a group is really big. And, just participating in whatever way works for you, you can't understate that impact. So, yeah, thank you.
So, now we would like to open up our table
Yeah, of
for
course.
our interactive session where
So we
viewers
had a
can
couple
ask
of
questions
pre-submitted
or comment to
questions.
Jill.
One of them
And
was,
if
why did you
you would
decide
like,
to
it is
study
also
public
your
health, and what
opportunity to get
motivated you
personal
to do
advice
so?
on any of your choices.
That is a good question. I think I
Start this and feel free.
a little bit, but I was not the person who knew what they wanted to do right out of high school. I kind of gravitated towards the sciences, but I really didn't know, no idea essentially. So I did go to university. I did sciences, and I developed more mental health advocacy kind of outside of my studies because I was studying general sciences, biology, molecular biology, and that. And then I had to do a few course changes, program swaps, and through a process of trial and error, really, I realized that I like sort of the high level problem solving and learning about systems and how they interact and that they impact. And so that was definitely, it took several years to figure out that was what I wanted to do, but that was what led me towards the public health route. Yeah, so it really is a process of trial and error and kind of checking in with yourself and seeing how you enjoy things and where you might want to go. Again, I would also suggest here reaching out to like professors or to individuals in the community if you're curious about certain positions or disciplines, asking them a bit about what the day in the life looks like for them and trying to identify what aspects of that appeal to you and what don't. I think that's really valuable. For me, I realized, when I was sitting plating bacteria in a lab that I didn't think this is what I wanted to do for what I wanted my day to look like. But someone might find that really satisfying. And so I think it's a matter of things and finding out what you don't like and what you do and sort of working your way from there.
All right. So
That's
going
a
on from
good
your college
question.
experience, since you started
Say
public
I
health,
have
what
one
was your most memorable
most
experience
memorable
while
experience.
working
I was pretty excited
and
to get
with
into my PhD program. So
working with
that's
like the
been
general mental
really
health
exciting for
umbrella?
me. As I was kind of saying, I love learning and I'm really excited to keep learning, and just knowing that that's ahead of me is very exciting. I've really loved the co-op placements, the work placements I've been able to do, trying to get different experiences with different organizations and different environments. That has been ring in terms of professional development and deciding where I want to go with my career. And connecting with all the folks in my cohort was really meaningful because it was the first time I kind of went from a big university undergrad cohort to a smaller sort of master's program with fewer people and people who were incredibly passionate about what they were doing and who came from a ton of different ideas to the table. And so that has been really great as well.
Mm-hmm. I mean, just that you're speaking about like your career, I was just wondering, like, what are your goals for your future? I know you're starting like your PhD and stuff, so I mean, what are you hoping for the future?
This is a good question because I truthfully don't have any concrete goals, 10 years down the road. I do hope I can maintain a balance between my personal well-being and my desire to advocate and to work hard and keep learning, because there is kind of my advocacy journey where I did burn out, and I want to make sure that I can continue learning and I can continue speaking with folks like you and maintain that passion and not burn out along the way, I guess. So if I'm still able to be doing what I'm doing 3-5 years from now and maybe have a PhD at the end of it, I'd be pretty happy. I will probably to
Right,
refer
and
to my
since
own
you are
lived
looking forward to your
experience with mental
PhD,
illness as being the most
I bet you've
challenging
encountered a lot of challenges along the
obstacle I
way.
had to overcome.
So which one do you
I've
think has
had a
been the
pretty
most challenging
privileged
experience?
route academically and socially, so of that, but a lot of it was, it was exacerbated by lack of access to services that were right for me. Took a long time to find what I needed, and then there was the whole process of self-doubt and not necessarily seeing myself in those spaces. When I was struggling a lot with poor mental health, I couldn't imagine that I could succeed. It just felt very overwhelming and discouraging. So having support throughout that and through several years and support from friends, family, doctors, that definitely helped me overcome that part. And it will always be something that I'm working on. But I think those struggles were probably the most challenging part, but also where I grew the most and where I learned the most.
Yeah. And I mean, obviously, like, just speaking about your career again, there's obviously always people that we look up to. So even just with your own lived experience and your career itself, have you ever had a psychologist, scientist, professional, or just someone in general that you've looked up to?
I'm sure there are tons of people along the way. Uh, some of my most recent professors have been really great role models in terms of professionally what I hope to do and the knowledge that they have. I'm always happy to learn from them. A couple of therapists I've had have been people and really motivating, and definitely I think I looked up to them. Some friends and family members too, um, who've experienced their own mental health challenges and stayed the course and fought on recovery. That has been very motivating. Um, yeah, there's so many folks, and I'm very grateful to say that.
I don't think so. Yeah.
Alright, Yasmin, do you have anything else to add?
um, I guess I'd like to know what
Alright.
involved with the Shine project.
Um, alright, Jill, do you have
Yeah, of
any
course.
questions you would like to maybe
I
ask
kind of just
us
met
or something that you've
Sung
been
Young,
working on
and
doing?
she was the one who kind of got me involved with the Shine project. And this relationship with Sung Young started with actually like the Mood Disorder Society of Canada's National Youth Advisory Council, which Jill actually co-chairs.
Um,
And you
Yasmin, do you want to
know,
go first?
I really want to get involved in mental health, and I have personal lived experience with mental illness, and I wasn't finding great opportunities in my community personally. And I was trying to branch out to find multiple things that I can add my own input in as a student leader in a community that isn't necessarily that involved. And someone kind of invited me to join the Shine Project and for the podcast kind of committee. And I was really excited because I'm also somebody who wants to go into the health field, the medicine field as well. So being able to foster these kind of great community tips to people around the globe, even, that's so inspiring for me. And being able to talk about my own lived experience as something that I'm truly passionate about and something I want to go into, that's when I kind of knew that the Shine Project was something that I really, really wanted to put my time into.
That's awesome. I'm so grateful to have connected with you through the NYAC. And I truly think our society hasn't appreciated that folks with lived experience can bring to positions in the medical field in particular, because you will be the ones interacting with the community and having um, compassion and empathy from those experiences yourselves is so valuable. And I think we're moving in the right direction. Hopefully it will, but we still definitely have some work to do. So it's always encouraging to see young folks like yourself who are so eager and passionate moving into these spaces.
Alright, I'll go. Um, okay, so I met Sungyun through a summer program, and I saw that she was really enthusiastic about like neuroscience and psychology through the work that she did, and she one day created a group chat with all the members in the like from summer school, and she posted the opportunity for the Shine project, and I was like, well, yeah, since I already have like a strong interest in like neuroscience and psychology, let's give it a go. And once I joined, someone like told me different things that I could do, and over time, first I started out with researching for the social media posts about like just neuroscience and
That's awesome.
psychology
Thank you
facts
both
that
for
would go
sharing.
out weekly,
I
and
did hear,
I
how did you
proposed in a
know,
podcast
how
and
did you
I
discover your
like
interest
he
for
wanted to get my
neuroscience and
thoughts, and really
psychology?
I feel like this is probably one of the best ways since podcasts are fairly popular. So yeah, that's how I got involved with the Shine project. I think it was early, like pretty early on in like early elementary or middle school when I began to learn about the brain, and then for science fair, I did a project. I did a science project on um, delivering impulses on nerves, so that like stimulating nerves through electricity. And after I saw the uses that my science project could have in like the neuroscience field, it
That's
started to
awesome.
boost
That's one of my
started to
favorite
boost my
things
thought
is
that
seeing
maybe
the
if I
potential that our
expand on what I
knowledge
already
has,
know,
and
I
then
can
thinking about the innovative
benefit
ways and the
society in like
creative
a
ways
positive
and
way.
the positive ways that it
So then
could
yeah,
have
I just started to cast.
impacts. So that's always nice to hear about the experience for other folks where they kind of had that same realization. How do you folks feel the social environment is at your respective schools or in your respective communities with regards to mental health? And I guess I'm thinking like stigma in particular. Have you had positive experiences, or is it still challenging? I probably was in your shoes 9 or 10 years ago, so I'm kind of curious to see how things have evolved.
I mean, I can start. I mean, in my school area, we have something called like a Jack.org club. And, it's been really small, like from the years that have been previous from this year, like prior years. But recently, we were able to actually have a summit where we were able to have local speakers. So there was actually a alumni who was able to create like a book called like Why I Stay, and it was like 365 reasons that you should pretty much stay in the world and how you're super important. So we've had all these speakers kind of come forward, and teachers are actually very enthusiastic to sign up for students to listen to these speakers, because I know everyone knows that taking care of your mental health and learning more about mental illness is so important. It can help us in our studies as well. So I would say I think there has been huge improvement. I know, speaking of some past people that I know of, well, there was really no discussion about mental health, which is honestly not the best thing, because students need to know that there is support at school, somewhere that they go so much. I mean, they go there for so many months and years, and it's important that we provide them with that kind of support, especially with guidance counselors, with organizations at the school, with these relationships. So I would say, kind of on a general kind of answer, yes, I think the discussions on mental health have been really, really great, personally, in my experience at my high school. But I mean, I think my experience has been more meaningful because of my involvement with Jack.org. But yeah, that would be my answer to that.
I wish Jack.org was as prevalent as it is now back when I was in high school, because I had to get involved with that, and I think it's a fantastic initiative.
Mm-hmm.
Right, yes, in my high school, what they put like really strong emphasis on mental health. Like, um, if our principal is like giving an announcement, which he usually does at the beginning of the year, um, they usually a bunch of teachers also put emphasis on mental health, saying that if if you feel overloaded, it's okay not to come to school if you need to catch up, which is
Mm-hmm.
like the extent that they're willing to go to. And we
That's
also usually
awesome.
like need assistants, guidance
Are
counselors,
those reasons
and we have
your peers or
on-site
your students at your school use often,
an on-site
and
psychologist.
the psychologist?
And so then if something does come up and you need to talk to someone, you have to go straight to them and they'll be willing to help you out. Um, yeah, I'm pretty sure, like actually, according to guidance counselors, they definitely get referred to
You're
a
right. Like the
lot
school is such an
because they're
important
the
place
easiest to access,
that we
because
can
they also know you the best
intervene
because they're
and
not
provide
the
these
courses that
positive
you're taking and
supports during
working
the formative
after
years, of
school.
course. So I
So then
think
yeah,
that's
it is
fantastic here.
very useful
And I
to
totally agree that it's good to have these things. I was in high school. My school didn't have the same, stay home if you need to take a break policy, but I kind of did it on my own accord with the support of my family. if I needed to take a day off to recuperate, get things in order, or a couple days, half days here and there, I was grateful to be able to do that. So that's kind of nice seeing that there's more flexibility now.
Yeah, and I think it's also really important, as you said, that things come forward at our school. I mean, just speaking off of like a personal thing that happened, currently with my experience with the IB program, my IB coordinator actually came forward and sent a message with mental health resources, with phone numbers, with organizations that you could message. And I think teachers really need to, I mean, it's really great to see it in my school, but I think it's important that even around the world, even around Canada, teachers should really take the opportunity, because they are educators and role models, to ensure that their students have that support and ensure that they know that where the good resources are. So I was just going to talk about like how at my school, seeing my IB coordinator do that was honestly so nice, and it was so great to see that sort of thing.
Absolutely, I agree. And the same goes for like managers and business in the business world as well. Like we're not asking them to be mental health professionals or counselors, but even putting that discussion out there, saying these are some reasons, sort of making it clear that they're comfortable with the topic and that it's okay to be discussed, and providing options for students if they need them. I think that goes a really long way in changing kind of the culture and the stigma around things. And so that's really wonderful to hear that it's happened at your school. Do you both want to go into medicine, like med school? I know it's kind of early for me to be asking these things, but
Um,
that
I guess
is
I'll go
very
first.
cool. I have
Yeah,
really
I'm interested
unsteady
in med
hands,
school,
so I don't think
or
I could ever do that job,
well,
but
I'm aimed
kudos
towards
to you.
plastic or general surgery as of now, and
Yeah,
then if
and
I
I mean,
want, if
for me,
I
I think,
want to
I mean, I'm
specialize
not
in
really sure if I
emergency
want to go to med
surgery.
school, but I definitely do. I'm really interested in the kind of impact of environment and, the ocean and waterborne diseases on remote communities' health. I recently did like an internship, like a
I do.
fellowship with Dalhousie University on that topic, and I think I'm really interested just like studying remote communities, especially as I mentioned, how water and like the biogeochemical substances can affect the community as a whole, and how we need to bring awareness to communities like that. So I don't really know if I want to go to med school, but I know that I do want to go into something that is more humanitarian based, I guess.
That is a super interesting, kind of public health topic.
Mhm.
And I think we like to think in Canada that we have free, therefore accessible healthcare for everybody, but we often don't consider rural and remote communities in that, because it is so much harder to access health services, and in many times, and unfortunately, like clean and uncontaminated in these locations. And that's like such an important determinant for living healthy lives. So yeah, I I think that's really interesting.
Well, I think if there isn't anything else to kind of add or anything, I think it's a perfect opportunity to just kind of wrap it up. And thank you again, Jill, for joining us in our first episode.
Thank you so much for having me.
Yep. And for the viewers, if you're interested in working closely with Jill and getting started on mental health advocacy as a high school student, it'd be great to consider
That's
joining
awesome. I didn't even have to ask you to put that plug in
advocacy
there.
there's a group of high school students that
That's
come
what I think
together
is
every
pretty
summer
great,
and
is
help
that,
reach out
we're all trying to
to
do things
schools across
together. We're
Canada and
not
partner with other
like recreating the wheel. We're sort of harnessing our collaborative efforts and our collaborative power, so to speak.
Mm-hmm.
Teamwork makes the dream work.
Yeah, I mean,
Yeah, I'd be
teamwork
happy
is
to connect
what
with folks
gets
who are
a
interested or
bunch
who
of
have
people
any
places.
questions, and
Like,
I'll stay in
um,
touch with you folks at the
if you want to
Shine
get
project
like
too.
a really high place, you're gonna need to have a bunch of people supporting you so that
Thank you, everybody.
everyone can work together. Yes.
Thank you.
Mm-hmm. Awesome. Yep. And we hope you enjoyed listening in, and make sure to tune in again in 2 weeks at the same time, Saturday, 5 p.m. Eastern. Right. Thank you.